Can scars be avoided in cosmetic upper eyelid surgery?
People considering cosmetic upper eyelid surgery or upper eyelid blepharoplasty are often concerned about visible scars after surgery. They want to be assured that scars will not be obvious when their eyes are open or closed. As a specialist in all types of cosmetic eyelid surgery, I'll discuss how I apply science and art to the planning of upper eyelid blepharoplasty to make upper eyelid incisions become virtually imperceptible. I'm Dr. Amiya Prasad. I'm a diplomate of the American Board of Cosmetic Surgery, and I'm a fellowship-trained oculofacial plastic and reconstructive surgeon. As an oculofacial plastic surgeon, I specialize in all types of cosmetic eyelid surgery, ranging from upper eyelid blepharoplasty for hooded upper eyelids, Asian double eyelid surgery to create an eyelid crease, as well as other eyelid surgeries not typically performed by general plastic surgeons, such as eyelid ptosis correction and lacrimal gland prolapse repair. I often perform revision surgeries to correct the work originally done by other doctors. For example, I perform reconstructive upper eyelid surgery for conditions resulting from infection or skin shortage from excessive skin removal, or undiagnosed eyelid ptosis, as well as other upper and lower eyelid revision surgeries. In upper eyelid surgery, incisions are made for typically three reasons. One is to excise skin when there's a need to form an eyelid crease, such as in the case of Asian double eyelid surgery. Two, to remove or excise redundant eyelid skin causing hooding, or to access the fat and soft tissues under the skin responsible for excess volume in the upper eyelids. And three, to gain access to the levator muscle that may be causing the drooping of the eyelids. When excising redundant skin, particular attention is needed for people with darker skin types. Now, darker skin types includes olive skin in the Mediterranean skin type and a range of South Asian and East Asian skin types, as well as darker Pacific Islander to African origin skin types. Designing the optimal placement of the upper eyelid crease incision and determining the amount of skin to remove with minimal tension is critical. If the crease incision is too low, too high, or extended too far medially towards the nose and laterally away from the eye, the scar can be undesirably visible with the eyes open and closed. When tension is too high when closing an incision, the scar can become too wide as well as too thick. These principles can be very well illustrated in Asian eyelid surgery and in upper eyelid surgery for people of African descent. I perform Asian blepharoplasty for people of Asian descent for defining an eyelid crease, commonly referred to a situation where they have a monolid. The crease is created by first excising a thin strip of skin and reducing fat that is preventing the formation of an eyelid crease. I place sutures to connect the eyelid skin to the levator muscle, which is the muscle that lifts the eyelid. The sutures are placed to close the incision, and where the sutures are placed is where the eyelid skin folds when the eyes are open. By blending the incision line where the eyelids would normally have a crease, the incision line camouflages very well. In non-incisional double eyelid surgery, no fat or skin is removed, but rather a suture is placed in the same area so the skin folds when the eyes are open, thereby creating natural-looking eyelid crease. When I perform upper eyelid surgery for people of African descent, I'm frequently asked about the risk of keloids as well as the visibility of these scars. The basic principles I mentioned earlier applies. Proper placement of the eyelid crease incision and minimizing tension is critical to a successful outcome. In addition, the choice of sutures and timing of suture removal is also important. In our practice, we provide detailed aftercare instructions and we follow our patients very closely. Like any cosmetic procedure, the results of upper eyelid surgery is determined by the experience and expertise of the surgeon performing the procedure. I can also attest to the value of having an artistic eye, and at the risk of sounding too dogmatic, I can say that the margin between a successful result and complications can be truly measured in millimeters. I hope you found this information from my experience helpful. If you're interested in recommendations for your individual situation, you may contact us through our websites or call our offices to schedule a consultation. Thank you.